Hey friends, I am so very excited about today's interview. So I have been following Ray Higdon for a very long time, and he is just an amazing person. I've learned so much from him over the years, and he became a believer not too long ago, and I have been even more excited about the teachings. He's on fire for God, which really excites my heart. And but in the realm of ConnectMD, I actually heard about ConnectMD early part of this year. And I just passed over it. I really didn't understand it very much, and I couldn't really grasp it. And then about in early August, I saw Ray post about it, and I actually started becoming a little bit panicked about our own family's healthcare because my husband is retiring. We have a very good health insurance right now, but he is retiring at the beginning of the year next year. And we are going to be going to like what's called a catastrophic plan that pretty much doesn't cover anything unless it's like a really big, huge problem like cancer or a big event. So I was really excited to learn about this program because it's going to really meet my family's needs. So when I saw him post about it, I went and looked at it and I enrolled immediately. I never even had a conversation with him because I saw the value in it. So today I asked him to come in here and talk with us. I'm really excited. Let me see if I can bring him on real quick. So let me see if this will work. Send invite. Okay. So he'll be joining here in just a second. Thank you for your patience. And let's see.
Hey,
It worked. Yay.
we did it.
We did it.
I don't I
Okay.
don't think I've done one of these in a long
I know.
time on
I
Facebook
used,
at least. I mean, I've done
yeah,
them on all kinds of other stuff.
yeah, I used to do Facebook lives all the time, but maybe I should do them more again. But
Yeah.
thank you so much for being here. I was just telling
Yeah,
everybody a little bit about my
sure.
story and why I joined Connect is because my husband's losing his
Yeah.
insurance, or our family is because he's retiring, and so I saw the value in it for my family. So I never even talked to you. I was just like, "Yep, doing it. I'm joining. This is amazing."
Well,
And
it
with me, it was
was I think you're the one that I posted something and then you said more info.
yeah,
And by the
that's
time I got to you, I'm like, wait a minute, didn't you already sign
yeah,
up? Because
I did. I
you
got it
you
pasted.
asked, you went and searched it,
Yeah,
found it, signed up, and then I went to respond back to you, and you're already in.
yeah. I was like, I bet he's made a YouTube video about it. Maybe he has a link or something over there.
Yeah.
So yeah, sorry, I got a little
No, no,
impatient.
no. Hey, here we are. It's
Yeah.
awesome.
Okay, well, let's just jump right into it. If you don't mind, tell
Yeah.
everybody a little bit about yourself. What caught your eye about ConnectMD, and just kind of whatever you want to talk about from there. Just get.
Yeah. I've been a full-time entrepreneur marketer for 19 years. And I'd like to say that all 19 years were easy breezy and amazing, but I've had my ups and downs. I lost everything in the real estate market crash. Literally lost everything: divorce, foreclosure, all kinds of stuff, depression. And but since then have been able to do some cool stuff, build some businesses, and we have, so it's me and my wife. We've been married now 13 years, and we have two kids, one that just turned 5 and one that turns 9 next month. When I first saw ConnectMD, I think I heard of it in December, I want to say, and it was an interesting experience because I was brought into a meeting and I met with them, and I just thought, I mean, this isn't for me. I'll be honest. I'm like, I don't do any prescriptions. I've been to the doctor twice in 20 years. We don't do prescriptions. And we have Blue Cross Blue Shield. We have a concierge doctor here in Naples, Florida. And so I'm just like, this isn't for me. But when I got off the meeting, I felt God say, pay attention to this. I'm like, okay. Like that didn't make sense, right? Because I'm not a healthcare guy. I've never done anything around healthcare at all. Don't have no health. I've never sold health insurance. I don't know anything about health and care at that point. And so fast forward 2 months, I believe, maybe three. I got hired to speak at this event in Orlando, and I go there, and they're there. They were speaking there too, the founder and the president. And so I'm like, hey, what's up? And so I'm like, oh, cool. I'll get to see you guys, present, whatever. And so they saw me present. I saw them present. When I saw them present, I had a realization that, yeah, I may or may not use this service, but holy crap, does this help people? Because there were people in the audience that remembers, and he just threw it out there. He goes, hey, how many of y'all are saving money using this service? And this one lady gets up and she's saving $250. This other person gets up, they're saving $500. Another guy gets up $100. Another guy, I mean, I was just like, wow, this is crazy. And so that's when I realized how many people could benefit. And so I didn't even join then, but I just kind of took note of, man, this is going to help a lot of people, which I'm passionate about. I love helping people. And so I flew from there, went down to the Bahamas. I come back, and the president and the founder requested a meeting with me and said, hey, when we saw you speak, we're like, we want you to be part of the company. And I'm like, okay, what is that? What does that look like? And they said, well, we'd like you to be the VP of growth, and you'll and help us to grow this company. And so I'm like, okay. And I just want to point out, I've had a lot of offers over the years, and I'm very grateful for that, for my past and how God has helped me. But for the last 8 years, I haven't had any association with the company. I've trained, I've coached, I've led, but I've never had an actual interest in a company, even though I've had a lot of different offers. And so I prayed about it, and yes, I got nothing but yes. And so I'm like, okay. And so I get into it, and the hardest part was convincing my wife to use it. I'm like, just use it, babe. And so our son gets sick the very next week. Okay. Now we've been to urgent care maybe once or twice in their lives, like in 9 years. And I didn't know how much we would use it. I didn't think we would use it much. The next week, my 5-year-old son gets sick, and he's vomiting and everything. It's Sunday at 11 p.m.
Always.
He's getting sick. And she's like, all right, I'm going to take him to urgent care. I'm like, babe, please, just use the service. Just like, hey, they may tell you to go to urgent care. Can you just please use the service? And she's like, how do you use it? And so I'm like, just look, beep, 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 boop. 4 minutes later, she gets a call from the doctor. The doctor asks better questions than our concierge doctor asks, and determine that, hey, he just needs anti-nausea medicine. Just, we'll get it to the pharmacist, go get the pharmacist. And that's what got my wife so fired up about this, because what parent wouldn't want to be able to get on with an urgent care provider from home without having to leave in the waiting room, and everyone else is all sick, and then the second waiting room, and fight the traffic. And if you got multiple kids and you're a single mom, you get them all riled up in the car. Like, what parent wouldn't want that kind of push button access at no additional cost to an urgent care provider? I mean, if you're a parent, you should have this just because you're a parent, because your kids, my kids can be knuckleheads. Like we've just had so many times where either they got a bug, or they got a stomach ache, or they got something, like, things happen, right? Kids just attract this kind of stuff. They go to school, everyone's sick, they come home, they're sick. Well, what do we do? And it turns out, now that I've been a part of the company, I've done, research, and over 80% of visits to urgent care are non-emergencies. They could be solved over the computer or over the phone. Like, imagine, not just let's set aside the money, because I just had a friend that went to urgent care. Took him 3 hours. It was $2,700. Okay, so let's just set the money aside. Let's not worry about the money for now. But just time, just being able, 2 weekends ago was my son's 5-year birthday, and we come home, and my daughter she says, "Oh, my stomach hurts. We need to go to the hospital." Like she's dramatic. Like she's intense. And she's like, "We need to go to the hospital." And okay, maybe we do. I don't know. And so I'm like, "Babe, just use the service." And at this point, she likes this option because it saved her time, it saved us money. And so we're driving home. It's Saturday, 7 p.m. Beep boop beep boop. While we're driving, while we're still driving, 5 minutes later, doctor calls, says, "Where's the location of her pain? Is it lower right, lower left? Where's it at? Does it hurt when she sits still or when she moves?" And after he asks all the right questions, says, "Well, to me, we believe that it's just a pulled muscle. So just take it easy. Don't give her anything. Let's see how it goes." And he was exactly right, 100%. Saved us the time, energy, and money to go to the urgent care. Saved us worrying, like, "Oh my God, what if it is something?" And just having that peace of mind is just amazing. And so I'm honored to be a part of it. We've helped a lot of people with this thing, and we're going to help millions and millions of people with this.
Awesome. So, I don't know if you know this, but I once upon a time I was an emergency room nurse.
Oh, wow.
And I can absolutely agree with you that I would say probably closer to 90% of people in the emergency room shouldn't be in the emergency room.
They're clogging it up. And they're
There's a
making
time,
people sick too.
yeah, there is a time and a place. Absolutely. If you're in a car accident, you
Oh,
broke
yeah.
your leg, you're having a heart attack.
Yes.
There are absolute legitimate reasons. But I used to tell parents, don't bring your kids with you. If you're going to the emergency room, don't bring your kids with you. You're exposing them to everything that's there.
Well,
All the bronchitis.
and for some, it's not an option. If you're a single mom.
Absolutely. So I agree with that. But if you have an inkling that it could be resolved on the phone or on video, because guess what? These doctors are not going to be dangerous and tell you, "Oh, you're fine." If they think you need to go ahead to
any risk. Yeah.
If they think that you need to head to the emergency, they're going to say, "Go ahead and go to the urgent care. Go to the."
And
I can't. If they think it's something like pneumonia, they don't have X-ray vision. They're going to send you in. So, they will err on the side of caution. Absolutely.
They will. They don't want that problem. But there's so many, there's so many different things that can be solved over the phone or computer.
Yeah, I personally prefer to let's start with the phone. For me, I want to start with the phone before I have to head somewhere.
Absolutely.
That's just, I love that. So just in case someone is watching this and they don't even know what we're talking about, we've kind of like skipped the basics for them.
Yeah.
Oops. Do you mind just giving a quick overview? What is ConnectMD?
Sure. So I'll give the 60-second overview. All right. I'm like the Micro Machines guy, for those that recall who that is. So ConnectMD is a membership. It is not health insurance or health sharing, although many of our members have insurance or have health sharing. The top two reasons that people get ConnectMD is, number one, easy, fast, free access to urgent care providers from home. And most insurance companies, especially since COVID, now have telehealth and teledoc, but they typically charge for it anywhere from $50 a session all the way to $300 a session. I've seen that. I talked to a lady, she pays $300 if she does an urgent care virtual visit. Mm-hmm. Crazy. And so, but with us, it's no charge, no copay, no deductible, no contract, and you can have up to 8 members on one membership. Number two is for those under age 65, you get the top 90% of prescribed medications, which are generic. You get those at no additional charge. And so that is we have different plans. If you don't take any prescriptions or anything like that, and you don't want the other bells and whistles, we have lower plans. A lot of people choose the Platinum plan. The Platinum plan covers any acute mental health or chronic generic medication that you could possibly need. And if it's a brand name drug that you need and it's not on the list of free, you get a deep discount, which beats every insurance I've ever seen. And so, that's kind of the rub. And we are bringing out new things. I know that you've talked about this. We're bringing out chiropractic discounts, dental discounts, vision discounts, medical supplies. At Platinum, you also get access to a primary care physician. And so that's kind of the gist. So if you break your arm, ConnectMD is not, that's not the play, right? But for all those things, stomach aches, sore throat, all those things that, you could talk to someone over the phone or computer with, we can help, and you're not paying out the wazoo for that. And the average wait time, by the way, across the entire company is 16 minutes. That's amazing. For most people, it takes more than 16 minutes to drive to urgent care, and then you don't even talk about the multiple waiting rooms you're going to be in around a bunch of sick people. And so that's the quick rundown.
Yeah. And, a lot of people will ask me, what do I have to go to a certain pharmacy? And you get a card. I just grabbed mine real quick. You print off a card, you can go to any pharmacy. So, I have health insurance. So I'm like you, I don't take any medicines, but if I need a medicine, I'm just going to have them run my insurance and then run this, see which one is going to do better for me. So, and I've already had someone that joined as a customer who saved over $200 on one prescription using this.
We hear this every single day. Like I brought in, I don't know if you know him or not, but I brought in my friend Mark Harbert, and he was taking I think high blood pressure or something, but he was taking one thing, and then he was also taking prescription grade omega fish oils. And because we have an over-the-counter program too, where you can get ibuprofen, you can get all kinds of stuff at really ridiculous or free. And so he his one medication was $125 a month. His omega fish oils was $100 a month. Both are free. So his first month with us, he's saving $225 or $250 a month. Pretty cool.
Yeah, I mean, this is just such a good feel good company in business. I mean, because it really it's meeting people's needs. I mean, with this economy, I really haven't been a nurse for almost 3 decades. It hurts my heart when I hear people say they had to not fill their prescription so they could afford their groceries.
Yeah, you hear that all the time.
Like those blood pressure medications, the diabetes medications, chronic medications, they're getting free 3-month supply. If they're on our formulary. Yeah. And I have called, I have used the service personally. Like I'm like you, within 15 minutes, I was on the phone with the doctor. I called the pharmacy line because I wanted to be ultra picky and ask them a million questions because I wanted to see the kind of service that I was going to be recommending. They are so helpful. And they said, I said, well, what if someone's on a special seizure medication? It's not on the list that I can see. He said, have them call. If someone's on a medication and they want to know how much it's going to be through our program, let them call me. I can quickly look it up on the database. So it's an amazing
because the costs do vary. Like costs vary by state. They vary. Like pharmaceutical it's a racket. I mean, let's be honest. It's one of the most marked up things on planet Earth. And so costs vary. Like depending on the pharmacy, depending on the state. And so you just call them, tell them, hey, I'm in this zip code and this is where I'm going, and they'll tell you.
And don't quote me on this, but it's my speculation that as we gather more members, that our buying power will increase, and so that those they may be able to add. I'm not, like I said, don't quote me, but they may be able to add more discounts and things because as we have more buying power in the marketplace. That
is how it works. Yes,
I'm sure that's why we're adding on the new things, the dental, vision, chiropractic, and medical supplies that are coming on because there are so many people joining that now we can add on more services. So I'm really excited about those things, especially the chiropractic, because I've been using that for just overall wellness for years.
Great.
So I think you answered pretty much everything, all the questions that I have. If anybody does want the nitty-gritty details and you haven't watched that yet, we do have that 18-minute video here in this group that you can go watch that talks about the different plans. And Ray does a really good job in that video of just explaining all the details of the program. So
and I did see a question. I didn't catch the name. But the question was, so if you're on a prescription, can you just have that, transferred? And so it's actually easier than that. You just go wherever you get your prescriptions, present your card, and they'll actually give you the discount. So it's actually easier than having to transfer anything. You just go
That's a
there.
great question. The medications do not have to be prescribed by a Connect MD doctor.
Correct.
You're just using this, like a lot of people
Using the
have
card.
used the Good RX. It's kind of like that. It's
Yeah.
just a discount
It's
prescription plan.
it's stronger than GoodRx. You are getting more discounts than GoodRx for sure. But yeah, it is similar. You're just using it. And kind of like insurance, like a lot of people, they're like, oh, I don't want to switch. You don't switch anything. Like we just sit on top, whether you have insurance or not, or health sharing or not. And a lot of people like tag teaming health sharing in this, because health sharing, most of those programs, they don't cover anything under $400. Well,
Yeah.
how many things do we cover that are under 400? Like it's kind of like a really good marriage. And so this isn't, and we just don't replace catastrophic insurance. We don't replace, if you break a bone, we ain't helping you. I mean, if you're pregnant, like we can't do it, so you look at this being your first line of defense, saving on prescriptions. I did see someone ask about the 65. So, we pay, the company, I should say, pays a fee. We pay for the drugs that you get. All right. So this is a mathematical actuary kind of, business, a math business. And so those over 65 are legally required in the United States to use Medicare. And so with Medicare, you're getting most prescriptions at a, either free or a deep discount through Part D or whatever it's called. And so you're over 65, you can still use every other service we have, can't use the RX program. And because you should be getting a deep discount or for free through Medicare anyway. So why should we pay for what you already get for free? You know what I'm saying? But we have a lot of people that are over age 65 that love having the access to urgent care provider, because you want to avoid urgent care like crazy. If you're over age 65, like let's avoid that place. And unless you need it, like if you need it, go, right? But if you just got the sniffles, or your stomach hurts, or whatever, use this first, because you do get every service we have except the RX program if you're 65 and over.
Yeah, that makes sense. And a lot of times, they may have to wait 3-4 days to get into their doctor if they're sick. So this would be a great thing. And also in the future, whenever we do add dental, that's a lot of that Medicare does not, unless you're on some kind of specialty, doesn't cover dental coverage. So I think that's going to be a big help to a lot of people, is
For
having
sure.
that in that age group.
And for us, someone asked, what if you're not on Medicare? For us, it is an age. It's 65 and over. We aren't covering that. So you would use your normal insurance or whatever else for specifically pharmacies if you're not on Medicare.
Right. Yep. So let me see. Mine's not updating very quickly, but I think
I'm just kind of catching them as they come up. Like I'm Johnny on the spot.
I know you're fast. I didn't even see that was. I didn't refresh my screen quick enough. Okay. Well, okay. While we're giving y'all one last opportunity. If you have a question, ask your question. If someone wants to get enrolled and get started with this, how do they do that?
Get with you and get the link from you. And so, there's 3 different levels, and, you've been talking about, we are phasing out the current pricing model. So right now it's $30 for silver a month, no contract. It's $60 a month or $59 a month for gold, and it's $89 a month for platinum. Those prices are going to increase. All of them will still be under $100, but with the increase, that's when you're also getting the dental, the vision, the chiropractic, and medical supplies. And so if you're someone that you're not interested in those things, don't need those things, then now would be a great time to jump in, because you're locking in a great price. And anyone that's at, like, for example, the $30 a month price, you don't want those things, fine, we'll honor that, and you get to stay at $30 a month. And oh, by the way, if you refer 3 people, we even take care of that fee. So if you refer 3 people, and if we all know people that could use this. You know, like I just did a meeting for my buddy that way, about 2 miles away, and he had 35 people there because he said, you know, it was healthcare and happy hour, and you know, 35 people showed up, listened to my presentation, and almost everyone in the room is either joined or joining, and so like there's a lot of people that can benefit from this. There was a Gallup poll that said 114 million Americans are unhappy with the cost of their healthcare and prescriptions, and this is we're going to bring millions of people into this. Millions of people are going to be on this membership. I just know it. I believe it. And we're going to help a lot of people keep more money in their pocket. And it's not like we're trying to push pharmaceuticals down people's throats, but if you have to take them, like, save some money. And so we want to help you with that.
Right. There's a time and a place, of course. I want people to stay well and not ever get sick.
Absolutely.
But
and by the way, I don't know, you, Liz, you're pretty detailed, so you probably know this. Did you know you actually can ask questions to holistic doctors?
Yes.
Yeah.
I saw that. I actually shared that in the group. There is an entire
Yep.
section in the member portal where you can ask questions to holistic doctors, pediatricians.
Specialists.
There's a whole list of specialists. You can just send a question, and that's free. That's so amazing. I love that. I absolutely love that. Psychiatrists, dentists, there's a whole list. Yeah, that's amazing. Okay, so I actually don't know the answer. I don't know if I know the right answer. Someone asked if you're on Medicare and it's not covered under their RX program. It's my understanding you're not allowed to use any other.
For us it's an age thing, because it's you know, we don't have, you know, unlike insurance companies that have very, very mega profits, they can have research teams, investigators, you know, forensic scientists. Like we don't have that, right? We try to keep everything affordable for you. And so we just, if you're 65 and over, can't get it. And so you can't use the RX program. You can use everything else, which I think is still extremely valuable, but you can't use the RX program. There's no way around that. Unfortunately, and maybe there's a future version where we have that, but it's, you know, it would have to come at a heavier cost. You know, it'd just be tricky because,
What I would do in that situation is I would call, as a member, you have that pharmacy number, because the pharmacy also said that they can hook you up with resources. So that's all they do is the pharmacy part of it. So I would call them and say, you know, I can't afford this meds. What do I need to do about it? I'm on Medicare. They may have a resource that we don't know about. Someone asked about the plans changing, and it's my understanding that we as members currently at the 30, 60, and 90, we will be given the option to pay for the upgrade or stay
if you want. Yeah, it'll be up to you. You'll be you're able to stay at your price, not get the additional things, because some people won't want them. You know, we know that. We think most people will, but some people won't. And so we want to honor you and not just say, hey, your price has increased. We want to honor you and say, hey, if you want to stay there, stay there. If you want these additional things, then it's just upgrade. And so, and again, still held the same. You refer 3, it's free anyway. And so, like, you know, if you're worried about the price, refer 3.
Right.
You can easily find 3.
Right. 3 and it's free.
3 is free.
Yeah. There was something I was going to say about. I forgot. It's gone. Cal is asking about the upcoming GLP-1s and over 65.
I'm fairly certain. I'm 99.9% certain that is completely different, because that's a totally separate membership only for that, and so that I don't believe they're going to care about 65. So.
I do know, I did ask them, and they said it just for anybody wondering, it's not going to be the name brand medicines. It's going to be a compounded medicine. Yeah. So it'll be the semaglutide and tirzepatide.
Same thing, just not that.
Yeah, it's just generic compounded. So that is a question I get quite a bit on that one. And like you said, it's going to be called the FIT membership, and it's going to be a separate add-on membership.
And that will, and again, you know, we're not, just like prescriptions, we're not out pushing, you know, semaglutide and GLP-1 and saying, hey, everyone should take it. Like, no. But if you are taking it, that program is going to save you $500 to $600 a month. So if you're taking it, it's going to save you a chunk of change.
And that is going to come with a physician consultation. So
yeah, they're going to monitor you. They're going to help you out. They're going to do all that stuff for you. And then I saw someone asked about the omega-3, like how's, I have not, admittedly, I don't even take ibuprofen. Like I don't take anything. I take vitamin D, I take zinc, and I take turmeric. That's what I take.
you know what I'm gonna do today? I'm gonna figure that out. There are a couple of supplements.
So yeah, if you study it, I haven't studied it. Yeah.
I haven't done it either, but I'll do that today.
I know ibuprofen. I know obviously fish oils. I don't know the ins and outs.
Yeah,
it's a newer program. We announced it in August.
Everything else has been so exciting. I haven't even got, I mean, I'm learning new, just like I learned about ask the specialist a question just like 3 days ago. And I was like, what on earth? So yeah, I'll vet that today, Bill, and I'll post it in the group, whatever I find out.
Yeah.
So, and a few minutes ago, he said, if you wanted to enroll, to get with me, but get with the person who invited you into this group, because yeah, thank you but if you don't know who invited you, I'll figure it out. Yeah. So
I didn't know this your group or if everyone's group, but get with the person who invited you is the answer.
Yeah.
I didn't invite any of you, so don't come to me. Go to Liz or go to whoever invited you.
Well, thanks. But it is invitation. So that's how they're promoting the program. Because this, from my understanding, this used to be only available to businesses, correct?
Right. Yeah, for 4 years, they only did B2B. So they would go to an employer, and if that employer either wanted to pay for their employees to have this membership, or if they wanted their employees to have the ability to enroll. So we actually have 350,000 B2B members. And so this being available to the individual is new, less than a year old.
Yeah, I'm glad they released it because, I mean, I think it's amazing. I'm really excited about this.
What's cool is every single nurse, we enroll nurses like crazy. All of them are like, does this have an opportunity with it? And like they all are just, they get it. So we were at a photo shoot thing for a charity we're with, and the president of the charity is an attorney. His wife is the head of the PICU at Golisano Children's Hospital. And so I said, hey, can I talk to you about something? And I'm like, hey, I'm doing this thing and this is what it does. And I explained the program, my 60-second pitch. And she's like, y'all are going to kill it. I'm like, really? And she goes, there is such a huge need for the two things you just described. Like, you guys are going to absolutely kill it. She goes home, and I said it to her. I didn't say it to her husband. She goes home, tells her husband tells his pastor, and now we're seeing what that'll turn into. But one of my very first people that I brought in was a pastor, and I went to him and I said, hey, I bet a lot of your congregation pay high prescription costs. And he's like, well, I know they do because they tell me. And I said, well, here's this program, and if they sign up for it, if you sign up for it, and then we go to them, the church will make 15% of their memberships every single month. And so we go there, and I talk on it for 5 minutes, have them fill out a little form if they're interested in more. Over 50% of the congregation signs up. So now every month, and by the way, we hear a story every week. Someone's saving $100, $200, $300. And so now every month that church gets that 15% of all of their memberships sent to them, and they use that for their mission trips. They have I think they have 90, I want to say 99 girls that they have saved from sex trafficking in India. And the way that they've saved them is they bought them. They've actually gone and stroked the check to buy them from the trafficker, because if they don't, they're not a military unit, right? Like they would be killed. And so they have rescued back the lives of 99, brought them to Christ. It's just amazing what they're doing.
Talk about being the hands and feet of Jesus. Amen. That just gave me full body chills.
Amen.
I mean, this is the kind of thing that you don't think about.
Yeah.
that how the trickle
Yeah.
effect of something like this. I mean, I'm still, the Holy Spirit just woo.
Yeah.
That's beautiful.
Yeah.
That's, you know, that's something you, like I said, when you're helping, fund the church.
Yeah.
Wow.
And,
That's beautiful.
you know, and hey, I'd like to believe, and this may or may not be the case, but I'd like to believe that if over 50% of the congregation is now saving money every month, is it possible that they give some more to the church than they were able to before?
Or
Very likely.
or bless a family that needs to be blessed,
Yeah.
or,
Yeah.
be able to, it just, saving money is, it changes everything.
And it's
So
needed. Yeah.
yeah, keep the money in our pockets and to do with what we want to do with it.
Yeah.
It's awesome. Okay, I think we are all caught
Cool.
up. Thank you so
Yeah.
much for your time. I
Yeah.
really appreciate this. I thought I was going to have to cancel last minute, but I
I'm
didn't.
glad
So
you're
thank you so
feeling
much for
better.
thank you.
Yeah.
All right, guys, thanks for watching. If you have any other questions, you're watching the replay, just type your questions in the comments and we'll get to them. I'll get to them as soon as I can. You're free to PM me anytime as well. So take care.
Bye,
All
guys.
right. Bye-bye.